Good morning or good afternoon or evening for those joining from other time zones. My name is Chrissy Hart, and I serve as Senior Advisor with Together for Girls. In my role, I lead our work in Sub-Saharan Africa and manage aspects of our research and advocacy work, including our work on school-related gender-based violence and the collaboration I'll be talking about today. Oh, sorry, can we go to the next slide, please? Sorry about that. Which is a collaboration with USAID, the Aid Data Center for Development at the College of William and Mary, and the US Centers for Disease Control and Prevention, or CDC. So by way of a brief introduction, Together for Girls is a public-private partnership between national governments, including the US, Canada, and 23 countries where violence against children and youth surveys have been or will be completed. UN entities, including UNICEF and the World Health Organization, and private sector organizations. We work at the intersection of violence against children and violence against women, recognizing the profound connection between the two and the need for coordinated responses. We pay particular attention to adolescent girls because they often remain invisible or fall through the cracks in the development of policies and programs to end both violence against children and violence against women. So briefly, just to summarize our model, we take a three-pronged approach to prevention and response to violence against children, consisting of data, action, and advocacy. Data guides the way. We work with governments to implement national surveys led by the US Centers for Disease Control and Prevention as part of our partnership to document the magnitude, nature, and impact of physical, emotional, and sexual violence against children and youth. This data helps policy and decision makers, communities, civil society, and donors to take an evidence-based approach to generating political will and guiding effective policies and programs, as well as resource allocation for efforts to prevent and respond to violence against children. To date, the VACS have resulted in 9 national action plans with several more in development. Finally, we work with partners to engage in targeted and strategic advocacy and communications to raise awareness of the issue, improve data use for effective action, and help set global and national agendas. So we currently work in 23 countries with national partners that have implemented or will implement a VACS, including across Sub-Saharan Africa, where the majority of VACS countries exist, Latin America and the Caribbean, Southeast Asia, and Moldova. So just to quickly summarize the VACS methodology, the VACS are household surveys, they're retrospective, and they are conducted among 18 to 24-year-olds. At the country level, the implementation of a VACS is led by the national government, with CDC providing technical support. UNICEF often provides support and coordination. And this approach ensures that the VACS are embedded in national structures and nationally led. Extensive efforts are taken to protect respondents, including the implementation of a GBV response plan for the identification of acute cases of violence in the course of the survey implementation. And in relevant countries, HIV testing and counseling are administered in conjunction with the VACS for respondents who can receive results on their own. Finally, the VACS results are published in national reports, as mentioned, and these can be found on our website. Topics covered by the violence against children and youth surveys include demographic data, including socioeconomic status and education, the prevalence of physical, sexual, and emotional violence, and the perpetration of violence, gender attitudes as they relate to violence, health risk behaviors, including risk for HIV infection, physical, mental, sexual, and reproductive health outcomes, including unintended pregnancy, and disclosure and service seeking, as well as service receiving. So now I'll turn to our research focused on school-related gender-based violence, and this has really been a project in the works for about the last year and a half. So I'll frame the presentation of the findings by sharing UN Women and UNESCO's definition of school-related gender-based violence from their global guidance to address SRGBV. So SRGBV is comprised of any act or threat of sexual, physical, or psychological violence occurring in and around schools, perpetrated as a result of gender norms. SRGBV violates children's fundamental rights, is a form of gender discrimination, and has wide-ranging consequences for children's physical and emotional well-being, school performance and attendance, and the likelihood of experiencing or perpetrating future violence. While our research reinforces that school environments can enable violence, we emphasize that they can and should be viewed as protective spaces for children and an arena for broader social change to end violence both inside and outside of the classroom. So just some brief background on the project. The project is supported through USAID's Higher Education Support Network, and the Aid Data Center for Development has and continues to conduct secondary analyses of the VACS to identify the prevalence of SRGBV, as well as details on violence perpetration, victimization risk, and post-violence behaviors in selected countries. CDC is a technical partner on this project, and Together for Girls' role is to translate the data and findings for an array of audiences to inform conversations at the national, regional, and global levels. So the methodology, the secondary analyses considered 7 VACS data sets from Honduras, Kenya, Malawi, Nigeria, Tanzania, Uganda, and Zambia, utilizing cross-sectional regression analysis techniques. And the key research questions that we asked include the following. So the national prevalence of SRGBV, whether boys and girls are experiencing similar rates of SRGBV, whether boys and girls are likely to experience one form of SRGBV, how SRGBV affects rates of school absenteeism for boys and girls, and the patterns for disclosing incidents of SRGBV and seeking or receiving services. And in terms of limitations, just a few things to mention, that while the VACS do tell us more about violence in schools than any other widely applied survey, they are not explicitly focused on educational settings or SRGBV. And as a result, the SRGBV estimates that I'll present here may not be fully representative of the spectrum of forms of SRGBV that are experienced by students. And just to note that while Kenya and Tanzania were part of the analysis, because the surveys were older than the 5 other countries, they didn't provide sufficient data to produce overall estimates of SRGBV. So now to the findings. This graph displays findings for overall rates of gender-based violence among survey respondents who had ever attended school and experienced one or more forms of sexual violence or physical violence perpetrated by classmates or teachers. So you can see that there's a significant variation in prevalence by gender. Uganda has the highest proportion of students experiencing SRGBV, with 54% of male students and 45% of female students, while Nigeria was the only country where female students overall experienced higher rates of SRGBV. And just to put these percentages in proportion, based on World Bank population data from the years that the VACS were conducted, the numbers for Uganda represent about 4.5 million students in sum, and the Nigeria data represents about 13.5 million students. So these graphs represent physical violence perpetrated among students. We found, unsurprisingly, that males overall were likelier to perpetrate and experience physical violence, and that female students were overall much more likely to experience physical violence at the hands of another female student. Next slide, please. And then in terms of school absenteeism as a result of physical violence, we found that peer violence in schools resulted in high rates of absenteeism, and that girls generally experienced greater rates of absence because of the experience of physical violence. In Uganda, nearly 30% of students experiencing physical violence at the hand of a peer missed school as a result of that experience. Now, turning to the prevalence of sexual violence, we found that Malawi was the only country where female students reported experiencing significantly more sexual violence perpetrated by a classmate. And because of the way the question is asked in the survey, this indicator is not disaggregated by the sex of the perpetrator, only by that of the victim. And rates of sexual violence perpetrated by teachers against students were lower overall, but girls were consistently at least twice as likely to experience sexual violence at the hands of a teacher than males. Next slide. So now I'll turn to some specific findings that summarize questions about physical violence perpetrated by teachers, which we've decided to brand as corporal punishment overall. So these graphs show the prevalence of corporal punishment perpetrated by teachers against male and female students. While we weren't surprised to see that male teachers perpetrate more corporal punishment overall, it was really interesting to note the higher risk for corporal punishment at the hands of a male teacher for all students in Zambia, Uganda, and Malawi, and then the opposite dynamic in Nigeria, which really reinforces the idea that robust data has a huge impact in elucidating these complex gender dynamics to ensure that SRGBV prevention and response efforts are as responsive to the context as possible. And one thing I want to note is that while gender attitudes weren't included in the secondary analyses, the VACS does include a question on attitudes around gendered violence. So in Uganda, for instance, the country with the highest rates of corporal punishment, half of 18 to 24-year-olds, so 57% of females and 48% of males, believe it's acceptable for a man to beat his wife. This underscores what we understand about gender and corporal punishment as a mechanism for the reproduction of inequitable gender norms in and beyond schools. And this has a bearing on educational outcomes and attrition in school attendance, as well as physical and mental health outcomes, particularly among girls, but certainly for all students. So we're currently producing a policy brief on gender and corporal punishment that will take a look and do a deeper dive into some of the legal frameworks and some case studies of best practices and promising approaches at the country level. And then returning to the issue of school absenteeism, absenteeism as a result of corporal punishment among the 4 sub-Saharan African countries varied from about 1 in 10 to 1 in 4. And in Honduras, we didn't include this in the prior slide, but corporal punishment has been banned since at least 1996 and arguably since the 1920s. But only 1% or less of both boys and girls reported experiencing corporal punishment. But I think it's notable that over half of girls and 1/3 of boys who did experience corporal punishment reported missing school. And this is really reinforced by recent reports from UNICEF that severe forms of corporal punishment are still implemented in Honduras, notwithstanding the long-standing ban. So next slide, please. And the last topic I'll turn to is disclosure and access to services. So I've taken examples here specifically from Nigeria. The analysis findings from Nigeria demonstrate that while very few students are disclosing experiences of physical violence, almost no students are seeking or receiving them, indicating a major gap in information about and also confidence in seeking services. The findings were very similar for Zambia and Uganda, while disclosure rates were actually under 10% for both Zambia and Honduras. And sorry, this was for experiences of physical violence. The next slide demonstrates rates of disclosure, service seeking, and service receiving for students reporting experiences of sexual violence. And you can see these are abysmally low. So now just to sum up a few takeaways and next steps. Some of the key messages include what we understand, but that the data really reinforces, which is that violence in school settings is gendered. So the VACS findings specific to school settings and school-related perpetrators reinforce our understanding that SRGBV is widespread and that violence in schools is inherently gendered. We need more and better quantitative and qualitative data that capture the array of SRGBV experienced by students in order to guide policy and decision makers, practitioners, and advocates. The VACS here really scratched the surface, and we know that there's a lot more to understand. Next slide. Finally, SRGBV prevention requires a multi-pronged approach, including the development and implementation of strong legal frameworks, evidence-based, locally grounded, and integrated interventions to create safe and accountable school environments, a focus on changing social norms around gender and the acceptability of violence, and finally, recognition of students' agency and their active inclusion in solutions. So now I want to quickly return to Kayleen's point and address the current reality of COVID-19 and the unprecedented interruption of education that's resulted globally with school closures that impact 1.5 billion students, over 90% of enrolled learners. So we know that this will increase existing gaps in access to quality education. That for students with access to remote learning, increased time online poses an increased risk of violence. And additionally, I just want to mention an excellent new report from the Malala Fund that drew on data from the Ebola epidemic in Sierra Leone, estimating that approximately 10 million more secondary school-age girls could be out of school after the crisis if dropouts increase by the same rate as a result of COVID-19 that they did from Ebola. Next slide, please. So just noting, I think what we understand, which is that shelter-in-place orders, curfews, and travel bans have intensified the risk of violence against children, and that child and domestic violence helplines have seen massive surges in reporting, while there is also widespread concern about underreporting in many locales. And finally, just to list out some implications for research that we're thinking about. So the first, importantly, reimagining the relationship between violence, students, and school, research that investigates the relationship between violence in the home, community, and school, and then building on research tools like the VACS that address the connection between violence against women and children's experiences of violence in all settings, including schools. Next slide, please. So very quickly, just to share that there will be a second phase of this research, which will focus on some deep dive analyses in 3 specific countries, and that Together for Girls is also partnering with Global Affairs Canada, CDC, and UNICEF on a Data for Change project that includes secondary analyses of the VACS focused on SRGBV and gendered barriers to girls' education. And finally, further information can be found on our website, including country fact sheets like the one pictured here that summarize the country-specific data.